Pediatric Obesity Surgery, Dr. Mark Kovler, Director of Bariatric Surgery Program, Children's National Hospital.
First guest is Dr. Mark Kovler. He is our bariatric surgeon. He's the Director of Bariatric Program at Children's National Hospital. And I wanted to invite him to talk a little bit about what are the new trends in bariatric surgery, in obesity surgery, and what's going on in the world. We're seeing all these medications come up in the market. Welcome to Surgecation, Mark. Good to have you.
Thanks for having me.
All right.
I'm looking forward to giving some information to patients and families who are struggling with pediatric obesity, because there's a lot of treatments out there.
What causes the obesity in the United States?
So it's a problem that we've been learning a lot about over the past few decades as we've seen this epidemic rise. 1 in 5 teenagers is suffering from pediatric obesity these days, which is a very scary statistic and important for us to recognize why that's happening. It's a combination of a lot of different factors. One very important and strong factor is genetics. So we see that obesity certainly runs in families. And we're beginning to learn about single gene polymorphisms that cause obesity and how we can treat those. But there's still a lot of genetic factors that we don't really understand. The second is the food exposures. We are now seeing teenagers that are exposed from early in life to ultra-high processed foods, calorie-dense foods, and foods that are really designed to be addictive in a way that they weren't 20, 30, 40 years ago. So in our patients, when we talk about lifestyle modifications, we do concentrate on a protein-rich diet and avoiding sugary, calorie-dense foods, particularly sugary drinks, because they provide no significant nutrition. They just simply provide calories. But our focus has really shifted to preventing obesity from developing in the first place, and then trying to understand how our bodies interact with the environment and with the nutrition that we take in, and why obesity has become so prevalent now.
So what is your message, if you had to summarize how one would understand obesity? What would that be to parents?
Yeah, so when a patient comes to see me, I know they've been trying lifestyle modifications, they've been trying diet and exercise, and that's what everybody's been telling them for their whole life. And what I tell them is, this is not something to blame yourself for. It's about the environment that we live in and the genetics that you were born with. So I often look at them and say, you can blame your parents for this. That usually strikes home with them, because this is the type of thing that runs in families. And really, genetics is the strongest thing that's driving obesity. And it's something that no matter how much diet and exercise we ask patients to do, they're not going to be able to change their set metabolism and the way that their body interacts with food.
That's a great point. So why do then, I know as I was growing up, I ate a lot of, foods that weren't really agreeing with me or I shouldn't have been eating. And I knew that there are people who tell me you need to exercise and change your lifestyle. Now I know, now that I've learned all this medicine and I read a whole lot about obesity, and I also do some obesity surgery. Now I know just work and exercise or changing your diet is not enough. What do you tell parents if they've tried everything and they're saying, well, what should we do next?
Right, so for 40 or 50 years, physicians and public health experts have been harping on intensive lifestyle behavioral treatments for obesity. And we've just seen obesity epidemic get worse. So clearly it's not the only answer or the most effective answer for obesity. Obesity is not a choice, it's a disease. And it's something that our patients are suffering from, and we should treat it like every other chronic disease. So it is a good, important part of the treatment pathway to encourage lifestyle modifications and improve nutrition. So no matter what we do with surgery or with medications, if you're eating a lot of calorie-dense food or drinking a lot of sodas, these treatments aren't going to work. But we know that those modifications alone will not lead to significant weight loss once a patient is suffering from severe obesity.
So that leads us to the point where I know we started with diet and exercise, and then in early 2000 there was 4 type of operation. I remember doing duodenal switches and Roux-en-Y's. And where is this timeline of, and now that there's medications, why don't you go over the timeline and see what are the current where treatments used to be before and where we're heading towards?
Right, so like I mentioned, 40, 50 years ago, obesity was just seen as a bad choice or bad habits. And intensive lifestyle modifications, diet and exercise basically were the only thing we could offer patients who had obesity. In the 2000s, late 90s, we as a society and as a medical profession began to realize that this is a chronic disease and we need to address it like all other chronic diseases, and really discover medical treatments and surgical procedural options like you mentioned. So bariatric surgery was the first thing that kind of came into the realm of treatment for severe obesity. And like you mentioned, there's been a number of different surgeries tried. There's been restrictive procedures where we aim to restrict the amount of food and calories that can be taken in. For example, laparoscopic sleeve gastrectomy, the lap band surgery, which was popular in the initial stages of bariatric surgery, and then other surgeries which reroute the intestines and change the way that food is digested. So one of the most popular historically has been the Roux-en-Y gastric bypass. And that what happens during that surgery is when you eat food, it bypasses a long portion of the intestines and actually doesn't get absorbed. So there's multiple mechanisms, and the surgery has come a long way from its early stages, and there's even newer surgeries being developed, such as the single anastomosis duodeno-ileostomy, single anastomosis gastric bypass, and many others that are being tried in adults to improve outcomes after weight loss surgery.
Right now. Okay, I know. So we talked about surgeries. What about medications? I know the televisions, all these channels, all these social medias inundated with all these medications that work great, and people are taking them, and Hollywood's taking them, and people lose weight. And I understand that kids are motivated to take them. And what's your stance on medications? Tell us, and especially to parents, a little bit of the medications.
So the truth of the matter is medications have been around as long as bariatric surgery has. It's just that nowadays we have had a breakthrough in terms of how effective they are. And we've seen that with what's called the GLP-1 receptor agonists, or what you see on TV, Wegovy, Ozempic, Zepbound, Mounjaro. We're at kind of a golden age in terms of medical obesity treatment, because the results from taking these medications far outperform the prior medications that were available. The problems are they're not available for pediatric patients broadly. They have a high cost and they have some side effects with them.
So Mark, why don't you tell us about the bariatric program or obesity program here at Children's, and explain things to parents. Maybe it'll be, maybe people want to hear what we do here, and it'll be good to hear.
Yeah. I mean, I'm very proud to be a part of this program, which has a long history. This program has been going on for 15 years, and we've done over 850 surgeries for teenagers to help treat obesity. We have a surgery side which involves yourself, myself, our nurse practitioners, and then we have a medical side which we work very closely with, which are the pediatricians who help on the medical management obesity side, and that's called the Ideal Clinic. With that, there's pediatricians, endocrinologists, nutritionists, physical therapists, psychologists. So we have patients come and get a very broad, very comprehensive evaluation, looking at all their medical problems that go along with extra weight and how we can treat those, and then come up with an individualized plan that involves medications or surgery or sometimes both.
And so with that segment, why don't you tell us what type of operations we currently offer here and what are the benefits with the operation, and go a little bit about other operations. We have parents who ask you and me, how come you only offer this and that operation?
So the surgery that we offer is called laparoscopic sleeve gastrectomy, and that is a medical term for a surgery that we do laparoscopically, meaning with a camera and small instruments on the inside, so there's no big incisions, which speeds up the recovery. And the sleeve gastrectomy means we take out about 80% of the stomach organ. And that works two ways. So the sleeve gastrectomy works one way because right now the patients come in with a stomach just like yours, just like mine. It can fit a lot of food in it before I feel full. I mean, I can sit down and eat a full plate of food or a full sandwich. After the surgery, after we've removed about 80% of the stomach, the patients are left with a smaller, narrow stomach that only accommodates a few bites of food. So they begin to feel full after just a few bites or half a sandwich. And that's one way that the surgery works. The second way, which may be even more important, is that the part of the stomach that we take out of the body controls a lot of the hormones that regulate hunger, that regulate cravings, that regulate the food chatter that goes on in a lot of these patients' minds. And that connection between the stomach and the mind is very much present. So after surgery, many patients have told me that they just don't think about food the way that they used to. They don't have the cravings. It's not constantly on their mind, that food chatter that patients describe. There are many other surgeries out there that we don't think are optimal for teenage patients. Those are on the malabsorptive side of the surgery spectrum. So that means rerouting the intestines in a way that much of the intestine won't see the food that you actually
You're not absorbing enough food, so you have malabsorption. That's the hell.
Right, and that has been very successful for some older patients who have very severe obesity or very hard to control medical problems associated with their obesity, like very hard to control diabetes.
But it's not ideal for kids because of malabsorption.
Yeah, there's a few problems with it. One is they're not absorbing the nutrition, and these are growing teenagers who are developing. Their brains are still developing. They still need a full nutritious diet. So we don't feel that that's optimal for teenagers. The other is that you can run into a lot of complications with those procedures, particularly nutritional deficiencies and vitamin deficiencies that can become quite dangerous and actually life-threatening. So it's very important for patients after they've had those surgeries to be monitored very closely for their nutritional deficiencies and for their vitamin levels, and to supplement those levels very judiciously.
Children's National Hospital, we're helping kids and teens take back their health and confidence. Our Pediatric Bariatric Surgery program combines expert surgeons, nutrition specialists, and compassionate care, all designed specifically for young people. It's not just about weight loss, it's about building a stronger, healthier future. For more information, please call 202-476-2151 or email us at bariatricsurgery@childrensnational.org.
What do you usually prescribe them after the surgery?
So after the surgery, the only medication that we ask patients to take for the rest of their life is a daily multivitamin. And they can find a gummy bear that they like, a certain tablet or chewable, anything that you can buy off the counter in a drugstore or a grocery store is going to work for them.
And okay, so what do you tell parents who are debating, should we do the medications, should we do the surgery, or both? Where do you stand on that?
I can tell you that surgery remains the gold standard for durable weight loss for pediatric patients. And by durable, I mean 10, 20 years down the line. Surgery remains the most stable, durable option.
I mean, I would imagine costs are also higher with medications, and it's weekly injections, which some kids don't really tolerate well.
Right. So
that also plays into
the
role.
medications, again, the results are great, but unfortunately, it's a chronic disease that requires chronic therapy. So what the studies have shown in pediatric patients is that although they achieve good weight loss over the first year and a half, if they stop taking the medications, the weight starts to come back.
Yeah, unfortunately, that's the sad reality.
Yeah. And surgery, it is a permanent change, but it is a one-time operation. So in some ways, some patients prefer that.
Okay. Another question would be, if I was a parent, what if you have the sleeve, and I know there's kids who have basically regained weight, some weight back. What are the consequences of re-sleeving or redoing that same operation? Talk a little bit about that population and what's done, along with there's a medication involvement as well in that group of patients.
Right. So in the past, bring up a great point, which is a small percentage of patients will gain their weight back, unfortunately. And that's a tough situation for us as providers because we've seen the patients be so successful and then basically relapse into their obesity.
Do we know the factors of relapse, or it's hard to determine?
Most
behavioral,
of it is behavioral. And for example, we saw a lot of that during the pandemic as people were not going to school, not getting the same activity, and we're at home living a more sedentary lifestyle, and the diet started to slip. Additionally, we weren't seeing them in follow-up, so we were catching it late. We saw a lot of patients come back with obesity relapse. And in the past, in those circumstances, we were looking at doing revisional surgeries, which do work. So if the stomach stretches out again after the surgery, you can go back again and do what we call re-sleeve or revisional sleeve gastrectomy, where you, again, reduce the capacity of the stomach. Other alternatives for older patients would be to convert that sleeve gastrectomy into one of those malabsorptive procedures.
These are, we're talking about older kids.
Yeah, I mean, those are kids
teenage,
who,
21
like
maybe.
Teenagers who lost a lot of weight and then now they're like 25 and they've regained the weight back. They're
not growing anymore. So.
They're independent. They finish puberty and development. And at that time, maybe conversion to a malabsorptive procedure is the right move for them if they do gain the weight back. But the important thing is that I do think the medications have totally changed the paradigm here. So with close follow-up, if I have a patient who's starting to gain weight back after surgery, I'll immediately send them to the pediatric side, the pediatricians, and have them started on one of these weight loss medications in order to curb that weight regain.
Thank you very much, Mark. Why don't you tell us what do you think the future lays in pediatric obesity, and kind of summarize the points for parents who are on this path, are lost, confused as to what to do, just a little bit, so it makes a clear understanding of what pediatric obesity is and where we're heading, and what do you think the right path is?
I think this all starts with changing the stigma around pediatric obesity. And that's been coming for decades now, but I think we're at an inflection point where we're starting to recognize as a society that obesity isn't a choice, it's a chronic disease that patients are suffering from and that they should be treated for. And now that we have these treatments, and these treatments are becoming very common in the community, I think more people who are suffering from this disease will be seeking treatment. And that opens up the doors for everything. I think the more patients who come to seek treatment at an obesity center focused on pediatric patients, the more people we're going to be able to help. We now have medications, we now have surgeries, we have endoscopic procedures that are on the horizon. So 10, 20 years from now, I think that epidemic that we're seeing rise is really going to take a curve in the other direction.
For better.
For the better.
Okay.
Yeah, we're really changing people's lives. You've been in the clinic when these folks come in a year after surgery. I walk in the room, I don't even recognize who the patient is because they look so different from the day of their surgery. And they feel better. They, getting around is better. They're able to get back to doing the things that teenage kids want to do, like playing sports or dating. And that's a change that just brings a lot of joy to us as providers.
So what are your key points to parents?
So I think if I was talking to a parent today, who was worried about bringing their kid in for treatment, I would say you're going to be amazed at the amount of options that are available to you, and your kid is going to be so much happier when they get treatment for this disease. So just make the appointment, find a clinic nearby that can treat obesity for children, and just make that jump. Because just like any other medical condition, you wouldn't leave untreated. You shouldn't do the same for pediatric obesity.
Thank you for watching and listening to Surgication. If you found today's discussion helpful, subscribe to our channel, share with other parents, caregivers, or healthcare providers who might benefit. To learn more or schedule a consultation, visit childrensnational.org, call 202-476-2150. Together, we can change the story of childhood obesity, one child at a time. Until next time, stay informed, stay healthy, and keep learning with Surgication.